Breaking news on CBS on Philly, Pennsylvania Secretary of Health Dr. Rachel Levine is providing an update on the spread of the coronavirus.
To date, no one in Pennsylvania has tested positive for the virus. However, officials say there are steps you can take to prepare for the eventual spread. Let's listen in.
Deputy Secretary for the Pennsylvania Department of Health. Since the beginning of the COVID-19 outbreak, we have taken a proactive approach to prepare and carefully monitor the health and safety of Pennsylvanians that were returning from China. Worldwide now, there are more than 81,000 cases of COVID-19, and there are more than 2,700 deaths. There are 57 cases currently in the United States. That includes approximately 40 from the Diamond Princess cruise ship. And there are no deaths to date in the United States. No one in Pennsylvania has tested positive for COVID-19. And I would like to repeat that. No one in Pennsylvania has tested positive for COVID-19. However, as the CDC, the Center for Disease Control and Prevention, advised yesterday, it is critical now that we be prepared for the possibility of community spread of COVID-19. Our Pennsylvania response teams, including our health systems, our first responders, our county and municipal health departments, state, federal, and local partners, are prepared to deal with disease outbreaks, including this one. To date, the Wolf administration has activated the Department of Health's Emergency Operations Center to allow for an enhanced and coordinated response. We maintain communication and outreach with all federal, state, and local partners. We have provided symptom monitoring for residents of Pennsylvania returning from China. We have provided information to healthcare professionals, businesses, and educational settings. And we are reviewing and adapting our current pandemic flu plan for COVID-19. The CDC expects more cases to continue to be confirmed in the United States in upcoming days and weeks, and wants everyone to take action to prevent the spread of this virus, COVID-19. We couldn't agree more. We know through our work in planning for disease outbreaks that it is best to prepare now. The same family emergency plans and kits that we have used to prepare for the flu or norovirus, which causes gastroenteritis, and even other emergencies like snowstorms and floods are very important now. We have tips and preparation checklists in our department on our website, the Department of Health website, health.pa.gov, for you to use for this preparation. Since the start of the flu season, which has been significant this year, we have encouraged Pennsylvanians to work to stop the spread of illnesses by washing your hands, by using alcohol-based hand sanitizers, covering coughs and sneezes, cleaning surfaces, and please, if you're sick, stay home. Those are really the same type of healthy habits that you should use to continue to protect your family and yourself against the spread of viruses in general and this virus, COVID-19. Now, as the situation evolves, we will continue to update Pennsylvanians through our website, our Facebook and Twitter accounts, and press releases and conferences as necessary. It's important to remember that the most accurate and timely information regarding this outbreak is available through the Pennsylvania Department of Health website, as well as the CDC's website and social media channels. At this time, I'm open for questions. Thank you very much. Yes, I'm sorry, please.
Before you go ahead, Mark, as we take questions, make sure that they're on topic, and please wait to be called on so that we make sure that there's only one question at a time. Mark, go ahead.
Good afternoon, Doctor. Hey, just two follow-ups from what you've done so far. One is, do you have any numbers on how many travelers from China have been subject to provide symptom monitoring? And also, could you go into any detail about the review and adaptation of the pandemic plans that's undertaken just for this?
Sure. So we are not discussing the numbers of cases that we have been monitoring. We have followed all of CDC guidelines for monitoring individuals that have returned from China. We work very closely with our county and municipal health department partners, but we're not going over specific numbers now. If there is a case of COVID-19 in Pennsylvania, we will inform you all and the public. In terms of our plan, there are similarities, but some differences between COVID-19 and influenza, and we wanted to make sure that we were specific for this potential infection of COVID-19 in Pennsylvania with our plan, and that update will be done by the next day or so.
It's ongoing.
It's ongoing, but we're completing and going over any questions now. But we are, to emphasize, we have been in incident command mode, and we are prepared in Pennsylvania. And I want to highlight our work with our community and municipal health department partners, all hospitals and health systems, the Hospital Association, etc., EMS, and then our close collaboration with other states, as well as with the CDC.
Can you discuss a little, Secretary, about preparations? Like, is there anything physical you're sending to hospitals, or?
Well, we have regular phone calls with hospitals and health systems, with HAP, as well as regular phone calls with our county and municipal health department partners about monitoring, etc. And then we have countless phone calls with the CDC, some with other states and some just with us. All the important materials that people would want to look at are on our website.
Again, please wait to be called on until you ask your question. Jim, go ahead.
Yeah, thank you. So, Dr. Levine, the medical community says of the 81,000 cases that have been confirmed internationally, there's probably a lot more mild cases that are just being ignored or not just not being factored into that 81,000. So, how much of that are you taking into account? Both I guess here in Pennsylvania and across.
Sure. So we are definitely taking that into account. So of the 81,000, the vast majority are in mainland China, but there are now approximately 40 other countries that have had at least one case of COVID-19. And there is a lot of discussion about the possibility of asymptomatic spreading of this virus. Do patients who are asymptomatic or mildly symptomatic spread this virus? That's still being investigated, but it does appear that you don't have to have full-blown pneumonia, of course, to spread this, and that is one of the concerns in terms of the possible spread in many areas of the world, the United States, and possibly Pennsylvania, about how it could spread. So again, we have regular discussions with other states and the CDC, analyzing all the data that is coming in internationally.
Andrew, go ahead. Sorry, your hand.
So in terms of ensuring that you guys have the resources you need, are there emergency funds that you can tap, kind of as, this is a moving target, I know right now, but as potentially Pennsylvanians, there are cases in Pennsylvania, and the outreach efforts seem to be more robust. Are there emergency funds you need to tap? Do you need to factor that into the appropriation going forward? What's going on there?
To reiterate, we have no cases of COVID-19 in Pennsylvania, but we do have preparedness funds that we get from the CDC. We also have funds that we get to work with hospitals and health systems from the CDC, and those are the funds that we are utilizing. However, if there ends up being community spread in the United States and in Pennsylvania, then we will need more funding. And of course, I know that the administration nationally has asked Congress for, I believe, 2.5 or so billion dollars for their response, as well as states. And depending upon how serious the spread is, that would be a start, but that might not end up being sufficient. But we are hopeful that Congress will appropriate that money to Health and Human Services and the CDC, and then as we need resources, we will get it.
Tony, go ahead.
Just before the press conference started, I was looking on news sites and saw a World Health Organization official saying the world is not prepared for this. And there's a lot of that out there now. You want to respond to that?
Sure.
To reassure Pennsylvanians in any way?
So I would absolutely like to reassure Pennsylvanians that the Pennsylvania Department of Health, working with our county and municipal partners and other very important stakeholders, are prepared for any potential community spread of COVID-19. We are working extremely closely again with other states and with the CDC in terms of our preparedness. When you're looking at the world, there are many, many countries that do not have robust public health systems that could be unprepared for spread, which would be very, very serious. And so I think that that's what they're referring to. But I don't want to underestimate the challenge. If we see community spread in the United States and in Pennsylvania, it'll be a challenge for all of us, but the Pennsylvania Department of Health, the Wolf administration, is up to that task.
Andrea, go ahead.
I don't want to come off as combative, but could you elaborate why you're not discussing numbers as far as people who are being monitored?
It actually has to do in terms of our law, in terms of the Disease Control Act, that we don't want to in any way stigmatize a person in a specific town or a specific county. I mean, you might know that someone came back from China, and if we say we're following somebody in X county, then you'll know who that person is. And so that would unfairly stigmatize that person. And so that's actually part of our part of the legal system for reporting in Pennsylvania. But if we have a case, we want to make sure the public is informed, and we will inform the public. We're not, of course, going to outline who that person is, but we will be informing appropriately the public if there is a case. But there are no cases in Pennsylvania.
Cynthia, go ahead.
Hi. So at the county level, how are local health departments preparing individually, and are they staffed with epidemiologists and testing materials that they can use in case there is a community outbreak?
Sure. So there are 10 county and municipal health departments in Pennsylvania. The two biggest that are known are, of course, Philadelphia Department of Health and the Allegheny County, but there are other counties and then a number of municipalities. And so we are working with them. We have regular phone calls with them so that we are all collaborating and coordinating. In terms of all the other parts of Pennsylvania, we are the health department there, and we have state health centers in every county where there's no where there's no other one. You know, we will work with them to make sure that they are prepared and that we're all on the same page. I want to emphasize in terms of testing is that all of the testing for Pennsylvania of any potential cases, any laboratory testing for COVID-19 is being done at the CDC. But our laboratory stands ready when we get the appropriate materials from the CDC to do the quality testing and then get up and running for testing in Pennsylvania. That would all happen through our lab as opposed to happening through any of the county municipal. But right now, all of our samples would go to the CDC.
Right, go ahead.
Thanks. Hey, Dr. Levine, a lot of this data I know may be available online as well, but can you just characterize and put it in perspective for people how the mortality rates and
Sure.
how the scope compares even to the common flu?
Sure.
And if we're starting to get...
Right.
Yeah.
So COVID-19 poses a significant health threat for the United States and for the world. If we compare it to a normal season of influenza, it appears that COVID-19, this novel coronavirus, is somewhat more contagious than influenza. It's not nearly as contagious as something like measles, which is tremendously contagious, but it's somewhat more contagious than influenza. And it seems to be, at least so far, from the data that we have internationally, but there's a lot still to learn, can lead to more deaths than influenza. Now, again, the data from China seems to be somewhat different than the data from Iran, and we don't understand all that yet. So the CDC and, of course, working with us, we're all taking that in. But it seems to be more communicable than influenza, and it seems to lead to higher fatality rate than influenza. The individuals that seem to be most at risk for very serious illness or tragically death are seniors, and are those with other serious medical conditions.
David, go ahead.
You mentioned a little while ago that if we would have community spread, Pennsylvania would need more funding.
what would you see as the immediate needs, things that we don't have now or we don't have enough of that we would have to get?
Well, we are prepared now. So, for example, we have our own stores of PPEs, personal protective equipment. But if there was significant community spread, then those stores could be depleted, and we would need to draw upon federal stores of that type of equipment. All of the different monitoring all takes personnel time and resources and computer time, etc. So eventually we would need to have our finances supported by the federal government if there is community spread in Pennsylvania.
How do we stand with things like, say, ventilators, isolation space?
Sure. Again, our excellent hospitals and health systems throughout the Commonwealth are working with us in terms of being prepared for any potential community spread and cases. If there was significant community spread, those resources could be taxed. We do have some stores of ventilators, but that could be a challenge. And so those are some of the challenges that Pennsylvania and any other state, and really the country, would face if there was significant community spread. But again, really in the United States, we have no community spread yet, and we do not have any community spread in Pennsylvania. We have no cases in Pennsylvania. But we want to be prepared, and so that's why, again, there is such regular contact with other states and the CDC to make sure that we are all coordinated.
Mark, did you have a follow-up question?
I was going along the same lines. Is there any physical stuff that you've obtained in the last few weeks? I'm thinking along lines of masks or whatever, but is it all you've got it all already, what you would need?
We have stores from personal protective equipment from our previous work, and so those stores still exist. There's no new stores that we have obtained. Andy, please tell me if it's correct. Yeah, that's correct. So, but we might, if we need to. The federal government has large stores of those too, and if necessary, states will draw upon the federal stockpile.
And similarly, if I could just follow up, what about training for healthcare providers that would be targeted about? Is that something you all would do or thinking about?
Well, we would work, so healthcare providers are and hospitals, health systems, EMS, are trained in terms of infection control. And we have done, for instance, tabletops and preparedness, some just that we have done and some that have been actually regional and national through the CDC and Health and Human Services to prepare for this type of event. But we will make sure that our hospitals and health systems are prepared if they have cases, and also particularly EMS to be prepared.
You mentioned a while back that you're in incident command mode. Can you elaborate?
Sure. So at the very beginning, we actually were in full incident command mode approximately two to 3 weeks ago as we started to monitor and track patients coming from China, which meant that we had staff 12 hours a day at our office, which is located at the Pennsylvania Emergency Management Association. After several weeks of that, we really established our policies, our procedures, and exactly how we were going to do that. And to save resources as well as to help our staff, we've kind of gone right now, since we have no cases, into virtual incident command, but we are prepared anytime to go back into full incident command at the Pima building.
Yeah, how are we dealing with travelers coming back from China?
Well, so there are different categories and different risk categories: low risk, moderate risk, high risk, and so they're monitored in different ways. And so some we have direct contact with, and some would be by phone.
Andrea, did you have a follow-up question?
Yeah, I had two actually. You mentioned test kits from the CDC earlier. From my research, some of those kits had faulty components, and they were supposed to be sending new kits. Have they updated you all with a timeline yet?
So there is no specific timeline when we will be getting those new kits from the CDC. The CDC is working, and their partners at the FDA are working on correcting any problems with the test kits. And as soon as they send it to us, we will get working on terms of all the quality control that we need to do. And then as soon as possible, we'll be doing our own testing. Right now, all the tests go to the CDC, and they have kept up with the volume.
And as far as you touched on the preparation for equipment. There was a concern that there weren't enough N95 respirators specifically, which differ from the surgical masks.
Yeah.
Are we equipped with those?
So again, we have full personal protective equipment, which include the N95 respirators. Hospitals have those. Could those resources be strained if there was significant community spread? Yes, in Pennsylvania and anywhere in the country. And so I know the CDC is working in terms of with manufacturers to try to have adequate supplies. But yes, if there was a significant outbreak in the United States, those resources would be strained.
Doctor, elaborate on that, what you would consider a significant community spread. How would you quantify that?
I don't have a specific number, but if you think of how many flu cases we have, and if this is more communicable and more serious, you can get a feeling for how serious it could get.
You mentioned the test kits are sent to the CDC. How long does that take? How long does it take for it to come back?
Sure.
And what does the patient do meanwhile?
So if a test is done, and then that patient will be asked to stay at home, and we will monitor that they are staying at home and how they're feeling and they're doing. If they're very sick, then of course, then they would go to a healthcare, they'd go to a hospital. If they were not very sick, then they would stay at home. The test would be sent immediately from our laboratory to the CDC. It could be sent directly, for instance, from Philadelphia to the CDC if necessary. The turnaround time there is probably a day, and then we would get the results. So probably 24 to 48 hours to get the results. Some of it depends on, they say they have no backlog, but depends how many tests they get. But we'll get the test as soon as possible. If that person is ill and needs medical care, they'll receive it. If they're well, then they'll stay at home.
David, go ahead.
Yeah, one of the local doctors that I talked to said, he explained, he's a little worried about the situation with the test. He told me about how important that is, and then he talked about sending it to the CDC. And so my question is, what do you would expect to eventually play out? I mean, it sounds like you're expecting to get tests to be able to test at the state lab. Do you expect there will be further local testing, such as will hospitals have access to it? But how do you expect it to play out regarding having a fast test?
Sure.
And when? Again, what's your rough time frame?
Well, so the CDC has not given us a specific timeline of when we are going to receive the new test kits to start our quality control and verification measures. When we do, we'll get them up and running as soon as possible. At that time, all of testing for Pennsylvania will be done at our laboratory in Exton near Philadelphia. I guess eventually there might be other types of testing that could be done. Point of care testing, I think, is what you're referring to. But right now, actually, the emphasis is on getting the test kits to states so that not all the samples have to be sent to the CDC. When we have test kits in Pennsylvania, the turnaround time will be much less.
Approximately, do you know how?
I don't know because the CDC doesn't know, and so they haven't told us. We are hopeful that it'll be. I mean, I know they're working on it very, very hard with the FDA, but if I knew, I'd tell you, but they haven't told us. So as soon as they send it to us, we'll get that up and running.
As you mentioned, obviously, if things get bad, resources will be strained. How confident are you that in Pennsylvania that the system will maybe bend but not break?
I am very confident that the Pennsylvania Department of Health, with our county municipal partners, with our hospitals, health systems, and fantastic medical personnel, our courageous EMS providers, etc., and then under the collaboration, with the collaboration of the CDC, are up to this task.
Barbara, I saw your hand, and that will be the last question.
Just wondering if Pennsylvania is taking part in any research to find treatment, cures?
Well, we have no cases, so we would not be involved in terms of any research in treatment. I know that there are that hospitals or health systems in the United States and internationally that have cases are trying different types of treatment. So, of course, we would certainly do what's called supportive care. So IV fluids, oxygen, ventilator support, whatever a patient might need in terms of that. But I think you're referring to specific antiviral. So countries and hospitals that have actual cases will be working on that. Since we have no cases, we're not. I know that the CDC is working themselves, but also with pharma in terms of potential vaccines as well. So I actually don't know if any of that work is being done by pharma in Pennsylvania, but not anything that we're doing. But that would really be on a national level, not on a state level. I think that that I have great confidence in terms of the ability to develop a vaccine, but I think it's going to take a while. There's not going to be any immediate vaccine. Once all that has to have extensive biological testing and then clinical testing, and then be tested for safety, and then has to be made. And so we are looking, out there in the future for a vaccine.
All right, thank you each for coming. If anybody has any follow-up questions, feel free to contact our office and we can get back to you on those.
Thank you very much for your attention.